It's pharmacology. Is it the most difficult subject, or maybe neuroanatomy is the most difficult subject? I'm not sure. But I know that many students struggle with this subject from step 1 to step 2 CK, and even my step 3 students still have complaints about pharmacology. Hello guys, welcome back to the channel. It's Uche Kennedy bringing you everything USMLE. And in today's video, we are going to be looking at how to study pharmacology. I'm going to be sharing with you resources, tips on what you should be doing, what you should be focusing on, and additional information on how to improve your performance in pharmacology and hopefully improve your performance overall during your preparation for the USMLE and get ready for that exam. Get it out of the way. All right, without much ado, let's jump right into it. The first thing we are going to be talking about here will be resources. When it comes to resources for studying pharmacology, I like to say that really any resource is good enough. I can't write anymore. Okay, when it comes to resources, I like to say that any resource is good enough. So that's the number one thing. There's an illusion that we have that one resource is better than the other resource, but different resources work for different students, and different students understand different teachers better than other teachers. So whatever resource you lay your hands on and you find it useful should be good enough, because at the end of the day, the mechanism of action of a medication does not change from book to book. They may word it differently, but it's still going to be the same mechanism of action. The only caveat here, however, is going to be that there are some of you that are going to be visual learners. You like to see stuff, you like beautiful designs, you like cartoonish kind of things. Then for people like that, stuff like Pixarize, for example, can be good. Stuff like Sketchy may be useful for those students. So if you're a visual learner and you like to look at things, you like beautiful images, you remember them better. When I was in basic medicine, I used to have a lot of students that would study microbiology with Sketchy, for example, pharmacology with Sketchy, and they would remember the images, the drawings, all of that wonderfully well. And for me, for example, I could never do that. I could not tolerate 5 minutes of Sketchy because I hate cartoons overall. Like I don't know the point of them, is what I'm trying to say, I guess. So in that sense, using such resources to learn for me was out of the gates zero, right? It was not possible. But a lot of people did it and they were incredible with it. So if you're a visual learner and you like beautiful stuff, looking at cartoons and stuff, Pixarize is great, Sketchy is great. For other students, of course, there is the big boy, Kaplan. There are multiple resources, your Bots and Beyond, all those resources, you know them. You can use any resource you lay your hands on will be great. The first aid, of course, is a short and concise, very useful material, especially when you have low time. So if you don't have a lot of time, you have 3 months to your exam, 2 months to your exam, you can't quite go and start studying any of the long resources, your first aid is more than sufficient. A lot of the pharmacology resource concepts in your first aid are discussed in a page or two, which makes the first aid probably the perfect material for reviewing pharmacology. Now, there are additional resources you would want to look at, and I'm going to recommend a few. One of them, of course, is going to be your UWorld, your question banks in general. So any question bank you're using, just make sure that you're using the question bank correctly. And we'll probably do a video on how to correctly answer pharmacology questions to maximize your development and to maximize your understanding and improvement in pharmacology. We'll look at that in a later video. But right now, your UWorld and any other key bank you lay your hands on is going to be very crucial, very important, right? In addition to that, there is this resource I had when I was in med school. We were recommended, and it was from 2000. I'll show you guys what from 2000 looks like here. Okay, this was from 2000. It's basically PHARM 2000. Okay, I'm going to write it down here so you can still see it. Just look up FARM 2000. FARM 2000 is it's not the best resource if you're already at the verge of taking the USMLE. But for those of you that are new to pharmacology, FARM 2000 is an incredible resource. It contains a lot of things that are not necessary for the USMLE, that are probably more useful for like Indian related exams. Maybe I shouldn't say Indian. For more non-USMLE related medical stuff. But at the end of the day, there's a lot of stuff. If you go to medical pharmacology here, they talk pharmacokinetics, pharmacodynamics, your regular pharmacology stuff, you know. And by the time you go through the practice questions, there are the I don't know whoever made this did a good job. There are millions of questions at this point on this site, and you can come here and do questions. The questions are generally short, straight to the point. You just pick one, you answer them, and you move on. You see, butyrophenol, antipsychotic. This is not a medication you need to know for the USMLE step one, but it's there, right? So you're just going to have to endure the things that are not necessary for the step one, but that generally for your understanding of pharmacology, that's still very useful. So Pharm 2000 is something I used, is something a lot of my colleagues used when we were in med school, and I think you guys will find Pharm 2000 very, very useful. The other advantage of this is that it's very specific. The subjects are well defined. So if I want to practice questions on anti-cancer drugs, it is literally labeled clearly anti-cancer drugs, right? I don't have to sift through a lot of things. Hyperlipidemia, it's clearly labeled hyperlipidemia. Hypertriglyceridemia, you can literally do questions on a very specific thing, which is what makes it even more enticing and a very fantastic resource for you to use. So take advantage of that. You can use Pharm 2000, especially for those of you that are new to pharmacology. It's going to be very helpful. For those of you that are already at the verge of taking the USMLE, it's enough to stick to your UWorld and maybe your Amboss, whatever key bank you're using, but you have to use them correctly. Now, the next thing we are going to look at are crucial questions. The next thing we are going to look at are going to be crucial questions you should ask when you study pharmacology. Of course, pharmacology is about medications. It looks like there's a lot of memorization, and there indeed is a lot of memorization in pharmacology. But every time you encounter a medication, there are a number of questions you should ask yourself if you want to remember that medication long term and remember the details about that medication in the long term. The number one thing you want to ask, of course, is what is the mechanism of action of this medication? What is the mechanism of action of chloramphenicol, tetracycline, whatever medication it is you're looking at? Every time you see that medication anywhere, you should ask yourself, what is the medication? I'm looking for a bottle of an antihistamine medication I had just a couple days ago. And one of the things I did when I picked up the bottle, I looked at the medication and I went, okay, this medication has chlorpheniramine. What's the mechanism of action of chlorpheniramine, for example? When you see medications anywhere, always for one moment ask yourself, what is the mechanism of action of this medication? If you're not sure what the mechanism is, quickly look it up. Look it up, put it away, say to yourself, okay, chlorpheniramine is antihistamine, da, 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 da. Do that. You have to always, I mean, every single time, even if you think you know it, always answer that question to yourself very quickly. What is the mechanism of action of this medication? Of course, the next thing you have to ask is what is the side effect, or what are the side effects of this medication? You have to answer that question every single time you encounter the medication. The third question you have to answer is, what is this medication a drug of choice for? Especially for those of you on USMLE step 1 and step 2 CK as well. Drug of choices are high yield on your exam. They don't expect you to know all the medications you're going to use in different scenarios, right? For example, you just need to know, okay, if somebody has Lyme disease, we are going to use doxycycline. If you know that information, you're prepared to answer questions related to pharmacology on Lyme disease. On step 2 CK is slightly different, right? On step 2 CK, at least, you begin to worry about, okay, does the patient just have Lyme disease, or do they have Lyme disease with heart block? Do they have Lyme disease with CNS manifestations? The medication sort of changes. But on step 1, you just need to know if they have Lyme disease, you treat them with what? Doxycycline. Now, it is straight up bam, 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 bam on your step 1. So you want to know what the drug of choice for staph is. What is the drug of choice for trigeminal neuralgia? What is the drug of choice for treating beta blocker toxicity? What is the drug of choice for treating atropine toxicity? You want to be thinking of these things factually. These are facts you want to know. Drug of choice for staph is very important. So whenever you study a new medication, you want to know, is this medication the drug of choice for something? Not is it used for? No, it is not enough to know what the medication is used for. We have a lot of anti-seizure medications, right? A lot of medications for seizures. But what is the drug of choice for absence seizures? We have medications that can be used in absence seizures. As you advance further, you're going to need to know that difference. Step 3, step 2 CK, you start making a little differentials between these medications. But for step 1, how do you treat absence seizures? Don't tell me, oh, you can also use topiramate or you can also use this. No, I want to know the specific medication that is the drug of choice for absence seizures. That would be etosuximide, right? But you have to know it for sure. Drug of choice for almost everything you do for USMLE step 1 is super important. So when you study a medication, it's important that you know if that medication is a drug of choice for something. After you've answered these 3 questions, you want to know if there are any additional or special concepts related to this medication. Are there any drug interactions? Are there any contraindications, for example? Is there anything I want to know? Does this drug have a narrow therapeutic index? And there are very few medications like that. Okay? So these are the crucial questions you have to ask every single time you come across a medication. What is the mechanism of action of this medication? What are the side effects of this medication? What is this medication a drug of choice for? Are there any special information about this medication I need to know? Stuff like drug interactions, contraindications. Is it a P450 inhibitor or not a P450 inhibitor? You have to think of those. Remember, a lot of you will say, Kennedy, but how can I be asking myself about these questions every single time I see a medication? Remember, repetition is the mother of skill. And this is even more so in pharmacology than it is in other subjects. Okay? So the more times you ask yourself about these concepts and try to remember these concepts, the better you would solidify your memory for all of these medications. The other thing I would like to say before I wrap up here is that you have to pronounce the medications. I noticed something with a lot of students, and some of them, my students, I will tell you guys, when the name of the medication is lengthy or it's not very easy to pronounce, and some of these medications are not easy to pronounce, they just and they just move on. They just gloss over it, and they don't make any particular effort to make sure they pronounce the word right. You have to be fluent. I have said this before. The USMLE is a language, and you want to be fluent in that language. Imagine if I'm trying to learn Spanish, for example, and I can't pronounce certain Spanish words, and I'm like, I just try to gloss over them and move on because they are difficult to pronounce. No, if you want to become fluent, you need to pronounce the words. Chloramphenicol, acetaminophen. You need to say them chloramphenicol. If you need to pause, if you need to slow down and say it, but make sure you say it. Call the names of the medications until they stick. Say it until you can say it fluently in a conversation. Okay, if a patient presents with this, we are supposed to give the patient acetaminophen. If the patient presents with this, we are supposed to give them chloramphenicol. These words should slide out of your tongue comfortably and easily. If you can do that, you will easily remember the medications and you are less likely to mix them up. Does that make sense? Finally, you want to practice questions, practice questions, practice questions. You cannot outdo a person that has practiced lots and lots of questions. Of course, you have to practice these questions correctly. You have to practice these questions correctly. But practice questions, practice questions, practice questions. You may have noticed that in this entire video, I did not say you should use flashcards. For a lot of you, flashcards may be helpful. I'm not a big fan of flashcards. But if you have found flashcards helpful in the past, you can use your flashcards. But in addition to that, make sure that you're practicing sufficient questions. And one more thing. Okay, let's call it a bonus. I promise this is the last thing and then the video will be done. General pharmacology is one of the most important things you want to learn. Okay, before you study pharmacology to any level, make sure that you understand general pharmacology. A number of things I'm going to mention that you have to know if you want to do well with pharmacology. Your general pharm, receptors, Where do we find alpha 1 receptors? Alpha 2, beta 1, beta 2, beta 3 receptors, M1, M2. Where do we find all of these receptors? What do these receptors do? You have to know your receptors. You have to know their location and function. You have to know the receptors. You have to know their location and function. Almost all the medications you're going to be learning about are going to be acting on receptors in one part of the body or the other. So if you don't know where the receptors are, and I mean, when I mean if you don't know, I mean if you don't know it better than your name. I've had my students where I'm looking at the student and I'm like, did you really just forget where beta 1 receptors are? That is an unforgivable sin. Read my lips. If I ask you, where do you find beta 1 receptors, and you think about it, you are already committing an unforgivable sin. You cannot do that. Where are alpha 1 receptors, it should come out like that. Where are beta 1 receptors, you should know it like that. Where are beta 2 receptors, you should know it like that. Where do we find M2, you should know it like that. If you're able to do that, now you can start understanding how the medications work. Okay, I know that alpha 1 receptors do this. Therefore, alpha 1 medications activate alpha 1 receptors, and so these medications do that. If I give a patient alpha 1 antagonists, okay, that means they are going to prevent the actions of alpha 1 receptors, which are this. Therefore, this will not happen. You see that if you know your receptors, their locations, and their functions, you are on your way to doing fantastic stuff in pharmacology. If you like this video, give it a thumbs up. Help me share it to other students. When you like videos, YouTube recommends them to more persons, and we'll be able to reach more students and help them out with their learning. Remember to subscribe if you're new to the channel, and I will see you guys on the next video. If you have any ideas, any questions you would like me to attend to address, put them in the comments as well. I read those comments and I'm going to attend or address those questions as quickly as possible. All right, until next time, I will see you guys in the next video.